I'm Emily Fausnaught, and I'm here with Dr. Todd Fausnaught, who's been treating opium patients since 2005 and is on Project Bald Eagle, which is the heroin task force for Lycoming County. So, Doctor, what drug has the most users in Williamsport?
I would say that the drug that has the most users in Williamsport is probably alcohol.
Okay. And which drug in Williamsport causes the most problems?
At this point, I would say that the drug that causes the most problems in Williamsport is probably still alcohol. However, the opiates, specifically pain pills and heroin, is closing in fast.
Okay. What is the most common way that you see people become addicted to drugs?
Most people will experiment with drugs when they're about your age, when they're in high school. They will be at a party, they will be with friends, and they will get peer pressure to try one of these drugs. The most common thing is marijuana, which is definitely a drug. They will experiment, they will try it. Sometimes they will take pills from parents or friends' cabinets, and they will gradually progress to drinking alcohol, or taking more pills, or trying other drugs, and it can become a habit from there.
Okay. What is the most common effect that the drug opium causes?
If you mean, I'm assuming you mean like pain pills or opiate type medications. That includes codeine, or oxycodone or hydrocodone, a lot of the cough syrups, heroin. They're all very similar. So you need to understand when people are drinking cough syrup, or they're taking Percocet, or they're taking other pain pills. That it's all very similar. If you specifically want to talk about those medications, you can very quickly become physically addicted to them. Gradually, as you take them, it becomes harder to get high, and when you don't take them, you go through physical withdrawal. You become depressed. It's hard to sleep. You get diarrhea. You feel like you have the worst flu you've ever had before. You get sweats. It's a very, very uncomfortable feeling, and gradually people take more and more of them so that they can feel normal.
Okay. About how many patients a year do you see have a drug problem?
Specifically in my practice, I treat 30 patients a year that are addicted to opiate medications, opiate drugs, and that might be pain pills or heroin. I could see very, very many more. However, I've chosen to keep my practice small at this point. I have patients every week calling, wanting to be part of my practice. I'm sure I could easily see 200, 300, 400 patients at a time to help with this problem. There are roughly several hundred, several thousand patients in Lycoming County that are addicted to opiate medications.
Okay. Well, I've heard that you like to treat patients with drug addictions. Why?
That's an unusual thing for doctors. Most doctors do not like to treat patients who are addicted to drugs, because it can be very difficult. Because people that are addicted to drugs will do anything to get their drugs, and have a difficult time admitting that they have a problem. They will lie, they will steal, they will cheat, they will do all kinds of terrible things to their body to get their drugs, and those habits become ingrained in part of their life. So as they're trying to get out of this life and get out of their addiction, a lot of those habits become part of their personality. So when you're treating someone who has a drug addiction, you're often treating psychiatric disorders, and you're treating habits that are very difficult to deal with. However, I get to know these patients. I see them initially every week, and then every month. and we get to know each other on a fairly intimate level. So I get a chance to treat some psychiatric disease that I normally wouldn't see and wouldn't normally treat, and I get a chance to see them turn their lives around. Oftentimes, we're not always successful, but I get a chance to see them really make a difference in their lives, often with the help of counseling, often with the help of spiritual changes in their lives, and with completely restructuring their lives, they're able to become a healthy person again.
Okay. Is it common to see teens addicted to drugs?
It is not common to see teens addicted to drugs. However, it is very common to see teens on the path to becoming addicted to drugs. It is common to see teens experimenting with marijuana. It is common to see teens experimenting with over-the-counter medications, with cough syrup, with codeine. It is common to see teens experimenting with cigarettes and alcohol. When it happens when you're a teenager, part of your brain is not developed. And that part of your brain, when you're experimenting with these things, never really does develop correctly when you are taking these drugs into your body. And as you get older, you have emotional problems and intellectual problems that you're never really able to deal with, and that make it much harder to be a functional human being as you get older and deal with problems that you started really as a teenager that could have been avoided.
Thank you. One final question. What are the steps to get over addiction?
It's so difficult. It really is one of the most difficult things there is to get over. And there's actually a part of the recovery community has something called a 12-step program. And it involves understanding that you're really powerless to overcome addiction, and that you need other people to help you overcome this, and that you need a higher power to overcome this. It's a long process. Most people didn't get there overnight, and that's why I say I don't see teenagers very often, because it takes years to get there, and it happens before you know it. I see a lot of people in their 20s that by the time they hit college, they have realized they have a big problem. So the steps involve first admitting that you have a problem, second, admitting that you're powerless to overcome it, and third, coming alongside others to help you overcome this, and taking the steps to be able to do it.
Okay, thank you so much.
You're welcome.